Welcome to this afternoon meeting on person-centered care for sustainable health systems. How to transform healthcare in the post-pandemic era. I'm Ekman, chair and coordinator for this project CostCare. Let me just briefly give a background for this project and what we have done so far. Between 2013 and 2015, we coordinated another European project financed by the 7th Frame Programme. It was called We Care, and the aim of it was to develop a European research and development roadmap towards healthcare cost containment while improving the quality of care. It was composed by so-called key people from Europe in different areas in healthcare, and composed by industry, academy, the healthcare sector, and of course patient organizations. You see the logos above who represented this project. During these 2 years, we wrote this R&D roadmap, and a condensed version is published in The Lancet 2016. The main, we agreed on that person-centered care and health promotion is the most important pathway for future health care. And we concluded that project with a conference, similar like today, a consensus conference where all were invited to vote on important enablers for sustained person-centered care and health promotion. Then we continued, next step, 2017, with the project CostCares. That is also financed by the European Cost Organization. We started by operationalizing the R&D roadmap. And that is published, this map and guidance how to test this roadmap and these test labs for person-centered care in International Journal of Environmental Research and Public Health 2020, last year. And we also tested a bit the roadmap in a Polish hospital, and you will hear more about that this afternoon, and also in Spain. The testing in Poland is also published in the same journal that I just mentioned this year. So you can find them, both of them, in PubMed. Let me just quickly take you through the agenda this afternoon. I am proud because I know it will be very interesting talks and discussions. And we will definitely talk to you, and you will be able to chat and also take part later on. But I'm very proud that Dr. Roberta Metsola, who is the Vice President for the European Parliament, she will kick off this conference, and she will also tell you how she sees person-centered care from a European perspective. Professor Patrick Jeurissen from the Netherlands is an expert in health systems and will give an overview over European models for healthcare. I will continue and go more in depth on person-centered care, how to practice, how we have researched it, and a little bit about implementation. Then we'll follow practical examples. In the pandemic era that we have right now, it's important to know how can we give remote care. So Dr. Lila Zali will tell you how we have evaluated remote person-centered care. Honorary Dr. Håkan Hedman, President for the Kidney Association in Sweden and a patient representative here, he will tell you how about the project plan for increasing home dialysis, and it's a great demand from the patient organization. Dr. Roman Lewandowski from Poland will tell you about what happened when they implemented person-centered care in his hospital, where he is the director. Dr. Heather Rogers from Spain, she is in a Center for Health Promotion, and they also implemented person-centered care, and she will present that. In this implementation process, we need standard, how to do it. And actually last year it was approved a European standard for person-centered care. And Professor Carl Svedberg will tell you how this was developed and how it works and how you can use it. Then Professor Jan Tonell will tell you more about the enablers that I mentioned we developed in the first project We Care. After that, you will be randomly invited to breakout rooms. There you will discuss a few questions concerning the previous talks on person-centered care and implementation. After that, you will all be invited to vote what question was the most important one. And then Dr. Des Colley from Ireland, Dr. Dala Krukshievna from Lithuania, and Professor Konstantinos Tagarakis from Greece. They will guide and discuss with you during breakout rooms, but also take part in the panel discussion which will be moderated by Professor Sandra Butinek from Malta. And then we will wrap up, I think, after a very interesting afternoon. Thank you.
Thank you very much for giving me the opportunity to address you at your concluding meeting on person-centered care. As a political representative, I am lucky enough to spend a lot of my days meeting people from all walks of life. I am often touched by the many personal stories I hear, but a select few become particularly hard to shake off. One of these conversations was one that I had with a patient a few years ago. He was, like unfortunately many others, going through a devastating time coming to terms with his health struggles. It was horrible to hear. He said he felt like within the healthcare system, he was merely a number, a medical wristband with a number. We need to change that. At its most basic level, healthcare is really about one vulnerable human being going to another and asking for help. It is, above all, a human issue. It is such a basic point, and yet it is one that we don't hear too often enough. Because too often the news and politicians speak in terms of statistics, numbers and nationalities and pills and paperwork. It is easy to fall into the trap of dehumanizing the issue. We cannot allow that to happen, because healthcare is about people. Throughout the last year, we have witnessed the strength of what the EU can do in the field of healthcare when it is united and when it puts the individual at the center of its policies. In less than a year, a vaccine was found thanks to our collective brilliant minds, and the EU secured vaccines for all its EU citizens, free of charge to everyone. What was different about this success is that for once, this health threat was something which affected everyone and not just the unlucky few. It was something that affected old, young, rich, poor, me and you. Suddenly it became so real. And this, as politicians, as healthcare workers, as administration staff, as citizens, is what we should never forget. We cannot wait for the end of the pandemic to repair and prepare for the future. There is still so much to be done to improve our current healthcare systems. We must build the foundations of a stronger European health union where the person is treated with dignity and with respect. The only way to do that is by continuing to put the person at the center of their own healthcare. This belief is one that I hold close and is reflected in my work as not only a member of the European Parliament sitting in the Environmental and Health Committee, but also as First Vice President responsible for the European Parliament's relations with national parliaments, and within my involvement on the Conference on the Future of Europe. I will keep making these points, and I will keep listening to your views. Thank you again for having me.
Hello, everybody. My name is Patrick Jeurissen. I'm a professor of fiscal sustainable healthcare systems, and I'm glad to be able to talk to you today for a little bit less than 15 minutes. A big kind of a presentation on healthcare under pressure, to kind of set the scene for person-centered care. I will do a couple of things. I'll go to the next slide and share with you something which we actually all know, and that's that healthcare expenses are rising, and they are rising across all countries. And we kind of know it, and we kind of have the feeling that if this is going on and on and on, that we have a problem, and we call that an unsustainable future of healthcare. Of course, it's really the question if this is really true, but for sure it's the case that if this somehow fits the 100% line, we have a huge problem because we cannot pay this. On the other hand, if we, for example, look at the United States, we see that the United States spends 2 times as much as most European countries, and they still seem to do quite okay in terms of the economy. So that's probably not necessarily the main problem we have. We go to the next slide, and I try to explain to you on slide 3 is this, why we still might have a problem. There are actually seven reasons for that. First is healthcare has huge benefits. We value health a lot. We value health more than anything else, actually. But a lot of this value is, so to speak, non-monetary. So it doesn't really add to the pockets of countries' economies. Not to say that it's useless. It has a huge value, but it's important to notice that. The second problem we have is that we do know that it's becoming ever more expensive to buy ourselves an additional unit of health. And I think expensive pharmaceuticals, sometimes topping 100,000 euros for prescription, might illustrate that problem. Then 3, because of that, and because of the fact actually that healthcare costs are very skewly distributed, we more and more need solidarity into our healthcare systems, because the most sick people cannot afford such amounts of money. And because of that, healthcare, because of the solidarity that we need in healthcare, healthcare also acts as a tax expense on the economy. And that leads to the fact that if we see it as a tax on the economy, and if also the case, what we saw in the first slide, that it increases more rapidly than GDP, it simply means that we have less fiscal space for other public priorities like education or defense or social security or whatever. And that means there is more fierce competition with these other necessary expenses. And then finally, and that's important for this talk, a substantial part of this health expenses can be considered to be waste. Not real waste, but waste in the sense that it not necessarily adds to our health. And that's, I guess, where the topic of today kicks in. Person-centered care, but also other models like, say, value-based care, many people know about. So we go to the next slide, and we see some solutions. These are all from Harvard Business School, by the way, but we see some solutions, some propositions. How do we get less waste or more efficient healthcare systems? And I have here 3 books, and I don't want to go in all of them. But first, we have a book by Regina Hetzlinger of the early 2000s, and she proposed like a real consumer-driven healthcare market. So healthcare as a commodity. And then, of course, much more knowledge. We have a book of Michael Porter, it's much more known, I think, globally, about value-based healthcare. This is about the outcomes of health. And then finally, we have a book of Clayton Christensen, and he faces on models of care. These are all kind of business-like types of dealing with this problem. And I'm not going into them, as I already said that, but the next slide shows us the building blocks of value-based healthcare. So this is the part of the proposition of Michael Porter, and this is strongly focused on outcomes. What we need to do is measure outcomes, measure costs, and then if we know all that, bundle it in a product, put a price on it, put it in some kind of organization, and then distribute it. And the fact, of course, is this true? Because this is kind of an alternative to person-centered care that Professor Ekman will tell you about in a couple of minutes. Now, let me tell you two slides, two real-world examples. You see here a woman that visited me quite some years ago, and she was telling me about the 16 different doctors she saw, the 10 different people with vocational education she visited, the 30 different devices, hearing aids, all other kind of stuff she was entitled to, and the 12 different kind of offices she needed to go to kind of get her right. I'm not going to tell the entire story, but the thing here is what we see is a typical complex patient, multimorbid, using many services of the healthcare system. And the thing is, how can we solve this? What is this? This clearly is a coordination problem. And typically we will say in our systems, this is maybe something the gatekeeper, the primary care physician should coordinate. But can he really? And I think that's a rhetoric question. So I ask her, I say, how do we solve this? Who should organize your care? And she told me, I should. And actually, I was thinking about it, and I think she might be right. I mean, this is so complex. The only person who really knows might be yourself. And that brings in something like the person-centeredness of it all. I give you a little bit more additional example in the next slide. We see here a slide which tells us about the huge varieties into European countries only in the combinations of inpatient and outpatient care. And the takeaway here is there's huge variety. Most business models, they don't want variety, they want less variety. But we see in practice there's huge variety. So we see our systems have a huge variety in how we operate, and we also see that there's huge variety in the different patients. Think about the women I just introduced you to. And then the case is, how do we deal with this variety? Do we streamline it and bundle it in certain packages, or do we use variety as a solution? And that brings me to the final slide, and also to kick in person-centered care. We did a study not too long ago on 2 hospitals that performed high-quality care at lower cost. And I'm also not going into that, but we did a literature review as kind of a pilot to the study, and we were searching for what were the strategies for these high quality, low cost kind of services in hospitals, and you see them here. And it's about upfront investment so that you can experiment. It's about giving way to the professionals, let doctors in the lead, things like that. It's about the flywheel effects of certain successful pilots, having a good information system, having a reimbursement system that at least doesn't hinder, stand in the way of these solutions. And this is what the literature tells us. But we also did kind of a huge survey in the hospitals. And I'm sorry, but I will read it aloud to you. But and we created, of these hundreds of people, professionals, we created a word cloud. So what were they thinking with say the fact high quality of care, lower cost? And I read some of them. So the bigger kind of words you see here on the right bottom half, it's about more time for the patient, healthcare close to the patient's home, giving patients a say in their own lives, shared decision making, higher professionality. So these are all kind of terms that that only very rather far off from the more business-like kind of strategies that come to us from economists, those kind of scientists, other people. So the word cloud actually tells us that if we ask professionals what would be what they think of if they want to have higher quality of care at lower cost, they think about something which is much more focused on person-centered care and not so much on value-based healthcare. I said here, but maybe I can also jump in some other of these buzzwords. And so we do know, and that's to end here, that these business theories hold actually very few predictive power. And that's what Professor Ekman will now tell you about, and that makes person-centered care such a fascinating subject, because it seems to have a lot of legitimacy among both professionals and patients, and actually it seems to have very good results, as we find in these two smaller Dutch hospitals. So thank you for attention. And I hope you have a nice stay here at the webinar.